to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borrelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome back to a new episode of Ask the Patient Advocate podcast. Today we're diving into a conversation that's both deeply personal and profoundly important, advocating for your health through genetic testing. If you've ever wondered about your family's medical history or felt uncertain about how to take proactive steps for your future health, today's episode is one you won't want to miss. Joining me today is Holly Sabo, a hospital administrator, advocate, and passionate voice for awareness around hereditary cancer risks. Holly has made powerful preventative decisions in her own life after losing both her mother and grandmother to ovarian cancer. Her story is inspiring and her message is clear. You have options and you are not alone. So Holly, thank you so much for joining us today. How are you?
I'm great, and thank you for having me.
Of course, of course. So let's start from the beginning. You've experienced firsthand the heartbreaking impact, unfortunately, of ovarian cancer. What made you decide to pursue genetic testing for yourself?
Yeah, that's a great question. So I had never known about genetic testing. With my family history of ovarian cancer, I was always nervous that I would get ovarian cancer too.
Sure.
But at that time, I just didn't know that there was genetic testing, and I certainly didn't really know what genetic testing was. It wasn't until years later when I had a new primary care provider, and she's actually the one that told me about genetic testing. It was a little disappointing because I wish that some of my previous providers had told me, but this particular provider told me, and really, I think that she saved me. Genetic testing was the way for me to go.
That's wonderful. Yes. It's so important that patients are educated on genetic testing because it is enough widely known. And I think that's great that you had a provider that did share that with you. So a lot of people don't know that with a positive genetic test, sometimes there's actual paths forward. What are some signs that someone might benefit from genetic testing, in your opinion?
Yeah, so I would say if you have family members, multiple family members that have had cancer, and particularly if it's on one side of the family, then that's a sign to get genetic testing. In addition, if you have had two or more unrelated cancers on the same side of the family, another reason. And if you have family members that were diagnosed at an early age, less than 50 years old, then that would be another reason to get tested too.
That's wonderful. So, if someone is listening right now and they're considering genetic testing, what would you say to them?
So, if someone's listening now and is thinking about genetic testing, I would say to definitely get genetic testing. I would also just prepare myself for what you might learn when you do have genetic testing. And you don't necessarily have to move forward and have risk reducing surgeries. There's other things that you can do if your test turns out positive. There's scannings that you can get done, or you might decide actually to wait for a few years before you actually move and do something if you choose to do something. There's no right or wrong choice, but knowledge is power. And if you do get a positive genetic test, you have something that you can share throughout your family, because that means that other members of your family might have a positive genetic test result as well. And they would probably need to know that too.
I 100% agree with you. Knowledge and education is power, and that's so important in genetic testing and so many aspects of your health. So, genetic testing is used for a wide range of conditions, including cardiovascular disease, neurological disorders, inherited syndromes. A lot of times, we can use now precision genetics and treatment for cancer and so many other disorders and conditions. It can also help in pharmacogenetics, determining how your genes affect how you respond to medications, as in precision medicine, which helps providers prescribe more effective drugs with the fewest side effects. So, How did you go about educating yourself once you actually got your results? Can you tell us a little bit about that process?
So I feel that I was lucky when my mother and my grandmother were diagnosed. There wasn't really the internet with all this information and all these resources. There really weren't any resources. But when, now in today's time, there's the internet, and the internet is just filled with different resources, different nonprofit groups. What I did was I joined several Facebook groups. I also joined a peer navigation group, and I had a peer navigator that experienced the same genetic mutation that I did and that went through the same surgeries that I decided to go through. I've also joined several nonprofit groups that are really for people that have genetic cancer diagnosis, or that are previvors, such as myself. There's so much information out there, and people are really willing to share their story because it's such a small group of us. And I found that people were very generous, and they shared their story with me, and they gave me resources, and I was able to get through with everything that I had to get through with my surgeries. And I'm here where I am today, and I want to do the same and spread the word and make others aware.
That's amazing. So you answered this a little bit, but I just want to further ask a question. Your strength and your message are so impactful. What's next for you in this journey of advocacy?
Yeah, so I definitely am going to continue to advocate and to let people know about genetic testing and different options that are out there if you do have a positive genetic test result. There's also a creative project that I have been quietly working on that most people don't know about. This has born out of my own journey as a previvor for BRCA1 gene mutation. Um, I'm not ready to share the details yet, but it's something that brings together the meaning of my genetic mutation and that others with the genetic mutation also feel and go through an identity. And there's quite a bit of beauty with this project that I'm working on. So I am going to share this project soon, but I urge people follow me on brokengene.store, where I will continue to advocate and where I will unveil my creative project very shortly.
That is wonderful. Thank you so much, Holly, for sharing all of that. To our listeners, if you've been wondering about your family history or if you've been putting off that genetic testing, this is indication to, start considering that conversation. If you have questions, get educated so that you are informed. Knowledge is key and knowledge is power. You are your best advocate, and help is available every step of the way. Private patient advocates like ourselves can definitely help you navigate that road. And if you need support navigating genetic testing, finding a provider, or just figuring out where to begin, we're here to help you. You can give us a call. Our main office is 947-517-8395. Thank you again, Holly, for your courage, your heart, and your advocacy.
Thank you so much for having me.
Of course, I hope this conversation helps our listeners feel more confident as they navigate their healthcare journey. Have a great day. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.